In this video, we are going to talk about age-related macular degeneration, or AMD. But ARMD sounds cool, right? Also known as senile macular degeneration. Starting with etiology, right? So the name of the condition is called age-related. So the first risk factor is age. Other causes include genetic variance, for example, abnormal complement factor H, family history, smoking, cardiovascular disease, hypertension, obesity, sun exposure, a diet low in omega-3 fatty acids, and dark green leaf vegetables. Right, so this can be the cause. Let's talk about the pathophysiology of AMD. Right, there are two forms. There is dry or non-exudative or atrophic AMD and wet or exudative, also known as neovascular AMD. Right, starting with the dry form. All age-related macular degeneration starts as dry form. And about 85% of people with age-related macular degeneration have only dry form. So about 15% will develop the much deadly wet form. Although only 15% of patients with AMD have the wet form, 80 to 90% of severe vision loss caused by AMD results from wet age-related macular degeneration, not from dry. All right, so let's compare these two further. Dry AMD causes changes of the retinal pigment epithelium, typically visible as dark pinpoint. The retinal pigment epithelium plays a critical role in keeping the cones and rods healthy and functioning well. Accumulation of waste products from the rods and cones can result in drusen, which appear as yellow spots, right? So I will show you the yellow deposits later. Areas of chorioretinal atrophy, also known as geographic atrophy, occur in more advanced cases of dry AMD. In dry AMD, there is no elevated macular scar called disciform scar. It's not there. Edema, hemorrhage, or exudation are also absent. As compared to wet AMD, wet AMD occurs when new abnormal blood vessels develop under the retina in a process called neovascularization. Localized macular edema or hemorrhage may elevate an area of the macula or cause a localized retinal pigment detachment. Right, so this is the disc form, right? That's the elevation which is absent in dry form but is present in the wet form. Signs and symptoms of AMD, starting with the dry form. The loss of central vision occurs over years and is painless, and most patients retain enough vision to read and even drive. Central blind spots, scotomas, usually occur late in the disease and can sometimes become severe. The symptoms of dry AMD are usually bilateral. Right, so these are the ophthalmological findings of intermediate versus advanced dry AMD. All right, so this is the intermediate form, and this is the advanced stage where you see those geographic atrophy. And also there is a drusen sign, right? These yellow deposits. So these are the main the main findings: the changes in the retinal pigment epithelium, and you find the areas of chorioretinal atrophy. Right, that is the dry age-related macular degeneration. What about wet AMD? Rapid vision loss, usually over days to weeks, is more typical of wet AMD. The first symptom is usually visual distortion, such as central blind spot, the scotoma, or curving of straight lines, called metamorphopsia. Peripheral vision and color vision are generally unaffected. However, the patient may become legally blind in the affected eye, particularly if the AMD is not treated. Wet AMD usually affects one eye at a time. So the symptoms of wet AMD are usually unilateral. In dry, they are bilateral. Right, so this is the wet form, right? So the fundoscopic findings include subretinal fluid appearing as localized retinal elevation, retinal edema, gray-green discoloration under the macula, exudates in or around the macula, detachment of retinal pigment epithelium, and is visible as an area of retinal elevation. Sometimes there may be subretinal hemorrhage in or around the macula. All right. How do we diagnose this condition? So as I said, I just mentioned fundoscopic examination, right? Other methods include color fundus photography, fluorescent angiography, optical coherence tomograph, or OCT. Both forms of age-related macular degeneration are diagnosed by fundoscopic examination. The visual changes can often be detected with Amsler grid. Color photography and fluorescent angiography are done when the findings suggest wet AMD, right? So they are not useful if the findings are suggesting the dry form. Angiography shows and characterizes subretinal choroidal neovascular membranes and can delineate areas of geographic atrophy. Optical coherence tomography, OCT, aids in identifying intraretinal and subretinal fluid and can help to assess the response to treatment. So how do we treat this condition? We can use dietary supplements for high-risk, dry, or unilateral wet age-related macular degeneration. Intravitreal antivascular endothelial growth factor drugs or laser treatments for the wet form of AMD. Right, for dry AMD, there is no way to reverse the damage caused by dry AMD. The patients with extensive drusen, that's those yellowish deposits, the pigment changes and or geographic atrophy can reduce the risk of developing advanced AMD by 25% by taking daily supplements of the following agents: zinc oxide 80 milligrams, copper 2 milligrams, vitamin C 500 milligrams, vitamin E 400 units, lutein 10 milligrams, or zeaxanthin 2 milligrams, beta carotene 15 milligrams, or vitamin A 28,000 units for patients who have not smoked. All right, what about the smokers? In current and former smokers, beta carotene can increase the risk of lung cancer. Recently, substitution of beta carotene with lutein plus zeaxanthin has been shown to have comparable efficacy. Therefore, such substitution should be considered in current or former smokers. The zinc component of these supplements increases the risk of hospitalization for genitourinary tract disorders. Reducing cardiovascular risk factors as well as regularly eating food high in omega-3 fatty acids and dark green leafy vegetables may slow the disease progression. However, recent large trials have not shown that taking supplements of omega-3 fatty acids reduce the disease progression, right? Okay, that's about the dry form. How do we treat the wet form of age-related macular degeneration? Patients with unilateral wet AMD should take daily nutritional supplements that are recommended for dry AMD to reduce the risk of AMD-induced vision loss in the other eye. The choice of other treatments depends on the size, location, and type of neovascularization. Intravitreal injection of antivascular endothelial growth factor drugs, usually ranibizumab and other drugs, can substantially reduce the risk of vision loss and can help in recovering or restoring reading vision. In a small subset of patients, thermal laser photocoagulation of neovascularization outside the fovea may prevent severe vision loss. Photodynamic therapy, a type of laser treatment, also help under specific circumstances. Corticosteroids, for example, triamcinolone, are sometimes injected intraocularly along with antivascular endothelial growth factor drugs. Other treatments including transpupillary thermotherapy, subretinal surgery, and macular translocation surgery are used but rarely. In the next video, we are going to talk about retinitis pigmentosa, so stay tuned.